Hello, this is Dr. Tapasvi, consultant pulmonologist, Gleneagles Global Hospitals, Lakdikapul. So, let us know about the prevalence of lung cancer, what are the causes of lung cancer, and what are the symptoms that patients will have if they tend to have lung cancer. So, firstly, lung cancer is the commonest cancer which affects a lot of people in the world. Happen to be the leading cause of cancer, especially in smokers. What we have to remember is especially in smokers. Doesn't mean that non-smokers don't have lung cancer. These days we are seeing non-smokers also come with lung cancer because of occupational exposure to smoke, or because of passive smoking, or if they are having any exposure to industrial smoke or dust, which could be the underlying reason for a lung cancer. So how do we know if the patient is having cancer? So most of the time lung cancer is very silent and comes up with symptoms only when the patient has ended up with stage 4 cancer. So if the patient is having chronic cough, which is not subsiding with continuous cough syrups, please visit your pulmonologist, do an imaging of the chest, let them do a physical examination, and we'll know if they are suffering from any infective cause of cough or if there is any underlying cancer. Cancer patients tend to have cough which has bloody sputum. When they cough up phlegm, it is stained with blood. That is also a red flag sign for lung cancer. Apart from that, they'll have shortness of breath because many a times lung cancer tends to have fluid around the lungs between the two layers outside the lung. So that is when, because of what we call as pleural effusion, patient tends to have this discomfort of shortness of breath. Thirdly, if a patient is having weight loss, if he is having loss of appetite, which is unintentional, you don't intend to lose weight, but you're losing weight at an alarming rate of loss of 5 to 6 kgs in a month or so, then we'll have to definitely think of a cancer growth in the lungs or anywhere in the body for that matter, which has to be addressed. And if smokers are having a patch on routine CT scan of the chest, which has to be followed up, your pulmonologist will advise you when you should go for the next CT scan, so that if there is an increase in the size of this patch or a lesion or dot on your CT chest, you will be advised to go for repeated CT scans, which will help us detect the lung cancer earlier in stage 1, so that the patient can be salvaged without a stage 3 or stage 4 cancer, which is way worse or way more difficult for a cancer specialist and the pulmonologist to take care of. Please be wary of the signs and symptoms of lung cancer. Try to detect it early. Avoid all the risk factors for lung cancer like smoking, pollution, and occupational exposures. Please go ahead with the routine medical checkups which the hospital gives you. So let's all be aware of the symptoms and prevent and avoid it whenever we can.